So that's a pretty important question about what does multicultural counseling encompass? What does this really mean? I mean, that's a loaded question. You know, as I said before in the seminar, a lot of times they used to in the past, even in the counseling field, think of things like ethnic groups, cultural groups, or the nation someone was from, or the color of their skin as multicultural. Of course, we know there's a whole lot more to that definition. So when we're talking about multicultural, it can be anything that really adds to the makeup of who a person is as a total person. I like to think of it kind of as a holistic approach. It could be things like their worldview on something. If they have certain values or beliefs on a particular issue that's really critical to them, or perhaps there's an issue that they really don't spend a lot of time on and isn't meaningful to them. That's part of what's multiculturally competent and appropriate to them. We also can talk about areas like religious beliefs, spirituality, and religious rights or lack thereof for someone. We can talk about how meaningful something may or may not be to someone, like their socioeconomic status. To some people, this may not even be important, but to other people, reaching the pinnacle, really arriving, working hard, and having a nice house, car, or living in a particular neighborhood may be meaningful to them. For other people, growing up in poverty, or growing up on a certain part of town, or growing up in a rural or an urban community can mean something to them. For example, some clients may choose to live in a rural community because of certain things they associate with that for them. Other people may prefer living in an urban setting because of what they associate with that. Then we have things like sexuality and beliefs surrounding that area. We have a whole variety of beliefs. So when we're talking about multicultural competency, it's what's important to that person. Basically, hearing their narrative, hearing their story. Now, we can't automatically assume that just because we look at a person who's a client and say, oh, they look like they're from this place, or on the demographic sheet it said they're in this neighborhood, or they're this certain age, or they act this way and their personality's this type, that necessarily that aspect of that culture is meaningful to them. We have to directly ask them. I actually think one of the most meaningful questions to a client that shows our sincerity and our compassion is just asking them directly, is this factor important to you? Help me understand you. I remember a client who I talked to in the past who was from a foreign country and then ended up immigrating here. And so I asked her, is the issue more your depression? Or I hear some things about your family background from the nation that you're from and the culture and opinions of that group. Is that something you want to explore? People will appreciate this. Or if someone comes from a certain part of town, or if they're facing certain health issues, or certain generational issues, we need to ask the client, is this a concern for them? So what it boils down to is multicultural counseling means meeting a client with empathy for where he or she's at, who they define themselves as a person, and what they would say are the important aspects of counseling for them. How does a counselor become multiculturally competent? Well, sadly, probably most of us in the counseling or mental health field have had maybe one class or a few classes in that. You know, we talked about in the seminar how some of us studied different groups, different characteristics of people, as if reading a few articles on them or doing 1 quarter or semester on that could make us so enlightened about multicultural principles. We all know unless you've lived among a group of people, unless you've interacted with them, unless you've had their experience, we're limited in terms of our cultural empathy. So multicultural competence, as we see more in the counseling and mental health field, is making a movement towards having more actual experiences with different sorts of issues and values. So for example, if I was always raised up in the city, and city life is what I tend to know about, and then I end up counseling in a rural community in Appalachia, I might not personally be real familiar with that demographic. So becoming multiculturally competent for working with that group might mean interacting with them, going to the places around town and the hobbies that they do, listening to the stories, listening to the folklore and the music that surrounds that area, hearing their stories, hearing their issues. So multicultural competence is not something that's a one-time thing that's developed in graduate school, nor is it something that you're just going to get from attending this seminar. I know the board might say if you get so many CEUs, it helps towards multicultural competency. But multicultural competency is truly a lifelong learning experience. Just when you think you're, quote, competent in one area, there'll be more areas to develop. The minimum standard generally would be to be competent in working with the populations that most seem to come to your practice or place of business. So for example, if you worked in a hospital in a certain setting, you would want to know who the patients of that hospital tend to be. Where do they tend to pull from? What are the things that are most common to them? Is it post-traumatic stress? Is it health issues? Is it depression or anxiety? Find out what those things are and at least minimally seem to get more education, CEUs, read what's in the news about them, listen to their stories, become part of their world. And that's part of developing that multicultural competency. So we talk about this topic of, can we just assume because a client comes in and they're of a particular group that is a crucial or important issue in counseling? Absolutely not. We can't assume that. There's a story that I tell a lot of times in this seminar that's referred to in the literature about an 11-year-old Chinese adopted boy who came over from China. And his first counselor really tried to make the fact that he was adopted and that he was from a different culture, an Eastern culture versus a Western culture, that he was Chinese versus Caucasian, the main issues. Wow, that counselor ended up failing miserably. That wasn't the issue for that particular kid. The second counselor hit on it though. That counselor ended up sitting on the floor with that young kid, just playing and hanging out with that kid, and the kid opened up about what the real issues were. That child opened up about things like being a preteen young boy and what that meant to him, and the things he was struggling with, the things he was trying to discover about life. Whoa, we could have really missed it if we were the therapist dealing with that young man and assuming that because he was from a particular ethnic group, looked a certain way, was adopted, that those were the key issues. It's just really like with any treatment goal a client comes in. It's important that we find out how the client, whether it be a child, teen, group, family, or an adult, how they define the therapeutic goals. What is important to them, and also to rule out what's not important to them. Now we're talking about the topic of true empathy, what the literature calls cultural empathy. And this discussion comes up often about, can I, as a therapist, truly empathize with someone who is different from me? I remember in grad school a professor raising that question. I remember this professor asking, is it possible for a man counselor who's very kind and empathic, compassionate and understanding, and has good clinical skills to counsel a woman who's gone through a rape? Could he possibly understand that? Or could only a female counselor, or even only a female counselor who had been raped before herself, understand that woman? This is where that concept of cultural empathy comes in. As counselors, we all are trained to empathize with a client, meaning to make statements, summary statements about the common feelings that we can tap into that we might all have as humans, even if we haven't gone through the exact same experience as them. Imagine if you've not been raped in your life, but you can reflect on the fact of what it could be like, maybe in another situation in your life, or hypothetically if you had a situation in your life where you felt violated, betrayed, intruded upon, or not respected. Those are things even a gentleman counselor could tap into if he was counseling a woman who had been raped. Those are things that a female counselor or social worker could tap into if she's connecting a woman who had been traumatized with some resources for going through her trauma. We don't necessarily have to go through the exact same experience. Now, having said that, some clients may desire that. That's where we need to find out what's meaningful for the client. There may be a client who lives in a certain neighborhood who struggled all his or her life with poverty and feels like, whether it's true or not, that as a therapist, you must live in a more prestigious area. You must have a much higher education than they have, and you must have never struggled in your life. While we know that can't possibly be true, they might really prefer someone from the area they're in and feel that person speaks more to them. So cultural empathy really deals with this topic of sincerely trying to relate to the patient or client about the feelings, the thoughts, and relating about what they're going through, as if we had been the one going through. So we may not necessarily have had to have those exact same experiences, but we need to convey what they're going through in a way that that client can say, yeah, you got it. You're not just trying to fake it. You're not just trying to act like you understand what I'm going through, but you get the universal feelings that we have as humans together about feeling hurt, betrayed, grieving, sad, planning new decisions and life transitions, going through issues in life. So we tap into those universal things, and through that, and through hearing the client's individual story, we can develop true cultural empathy. Another interesting area is this issue of developing culturally relevant treatment goals. That's not something probably most of you have heard talk about, and it's a rather new topic in the literature. Culturally relevant treatment goals, for example, would show respect for the fact that someone might be from an Eastern, communal, collectivist society as opposed to a typical Western society. For example, when I dealt with a young woman who lived with her extended family, meaning not just mom and dad, but in her 30s living with aunts and uncles, grandparents, and all sorts of relatives from the country that they all came from, I have to take that into consideration. I can't just act like she's a 30-something-year-old who lives in her apartment by herself and doesn't have the input of all those cultural family members. It's important for me to take that into account. So a therapeutically relevant goal for her would be finding a way to respect the opinions, the beliefs, and the values of the aunts, uncles, parents, and the native cultural views that she comes with, while also helping her make her own decisions about cultivating her life, her relationships, her career, and her personal mental health goals. If I don't include those other culturally relevant goals about her Eastern culture of origin, I might miss the point. And frankly, it may come across as very disrespectful to her. That's something we really have to consider. A lot of what we're taught in grad school is about self-actualization, being your best person, being assertive in boundary setting, setting up goals for yourself. And while those can be really good outcomes and meaningful, useful outcomes of treatment, they may not be the only outcomes or the crucial outcomes for everyone. As with this example I just gave, some people may benefit from things like maintaining the peace in the home. Some people may benefit from looking at resources in the collective community in which they're in. Some people might have values of respecting their elders, and that might not be as important of a value for another group. So it's important to find out what those differing cultural viewpoints are. That's how we can be truly culturally relevant. Our own culture can really affect the work we do. We're in denial if we act like our personal life, our personal narrative or story don't figure in. It's crucially important, whether you're independently licensed or not, whether you've been in the field for decades and think you really know what you're doing, to make sure you have colleagues with whom you can check in about your cases, that they can challenge you about what role your own values or beliefs may be having in terms of how you interact with a client. Are the client's values and beliefs different from your own? Does that push your buttons? Can you really empathize with that client if these are critical value and belief areas? What happens when the client asks you to support him or her in a therapeutic goal that may be kind of opposite of what you believe in your own personal life? Where do you go from there? It's really important to have a way to self-assess. This is generally not something we in and of our own self can just accurately do unless there's a colleague that we can check in with. So I would encourage you to find another colleague in the mental health field who's working with the same sort of clientele that you are in a similar setting, who can accurately check in with you about the degree to which your values, beliefs, opinions, your personal narrative, your background, and your biases and prejudices may affect your work with a client. It's better that you notice when those are red flags and could hinder therapy and possibly make an appropriate referral to other sources than trying to deny that and have it impact the clinical therapeutic relationship. How would we know when treatment goals are even met? Wow, that's a pretty important question. I would say with any client, it's important to have that client operationally define what they're coming in for. I talk a lot in my seminars about the idea of a camera check. For example, if a client's coming in and saying he or she is depressed, if there was an imaginary video camera there, what would a better life with less depression look like? Would they be hanging out more with friends? Would they be getting out of bed more, showering, and doing their activities of daily living? What would they be doing differently? Only when a client operationally defines things and we help them to have concrete, measurable, observable goals do we know what we're working towards. Whether we think these are cultural goals or they're just traditional therapeutic goals, we need to approach treatment goals the same. Whether religion, whether socioeconomics, age, family of origin, or other factors weigh in or not, goals should be operationally defined in terms of what the client states would measure them being, quote, less depressed, less anxious, more healthy, less in pain, more assertive, or a whole abundance of other sort of goals they may come in for. It's crucially important, whether you're independently licensed or not, whether you've been in the field for decades and think you really know what you're doing, to make sure you have colleagues with whom you can check in about your cases, that they can challenge you about what role your own values or beliefs may be having in terms of how you interact with a client. Are the client's values and beliefs different from your own? Does that push your buttons? Can you really empathize with that client if these are critical value and belief areas? What happens when the client asks you to support him or her in a therapeutic goal that may be kind of opposite of what you believe in your own personal life? Where do you go from there? It's really important to have a way to self-assess. This is generally not something we in and of our own self can just accurately do unless there's a colleague that we can check in with. So I would encourage you to find another colleague in the mental health field who's working with the same sort of clientele that you are in a similar setting, who can accurately check in with you about the degree to which your values, beliefs, opinions, your personal narrative, your background, and your biases and prejudices may affect your work with a client. It's better that you notice when those are red flags and could hinder therapy and possibly make an appropriate referral to other sources than trying to deny that and have it impact the clinical therapeutic relationship. We can talk about the traditional Western versus Eastern perspectives. As I mentioned before, the counseling goals that would tend to correspond to the medical model and the DSM tend to be more Western type of goals. If you look at all the outcome studies and what techniques go best with which sort of disorders, you see traditional Western kind of things. Remember, we're using a medical model. That may or may not fit for everyone. For some people, they might use a more spirituality-based model. Some people might prefer just to talk to those who live in their community. They might prefer everyone in their neighborhood or church or all the, quote, grandmas and grandpas of the area or all the family friends get together and just discuss about the issue as opposed to having a professional involved. For some communities and some people, they don't look at a professional as someone who has additional education and can be helpful. They feel like a person who lives among them or is with them may be better able to understand and help them out. Some people may have a more communal view, and that's something we have to take into consideration. You might have essentially a group therapy session with certain people almost every time because their extended family is so large. And if you're used to doing individual counseling with one or two people at a time, that may be something very different to you. You might be someone who tends to emphasize, as a Western worldview and the traditional counseling goals are, on self-actualization, becoming the whole best person you can be. And not that that's a bad goal, but for some people, they may look at not rocking the boat, basically respecting the sense of community, maintaining the peace and the balance. So that may be very different from the traditional Western goals. And that may be something you need to consider, especially if you're dealing with insurance companies, because they might be looking for that Western goal language, and you have someone who's in a different worldview, and making sure you're respectful of both of those areas. How would we know when treatment goals are even met? Wow, that's a pretty important question. I would say with any client, it's important to have that client operationally define what they're coming in for. I talk a lot in my seminars about the idea of a camera check. For example, if a client's coming in and saying he or she is depressed, if there was an imaginary video camera there, what would a better life with less depression look like? Would they be hanging out more with friends? Would they be getting out of bed more, showering, and doing their activities of daily living? What would they be doing differently? Only when a client operationally defines things and we help them to have concrete, measurable, observable goals do we know what we're working towards. Whether we think these are cultural goals or they're just traditional therapeutic goals, we need to approach treatment goals the same. Whether religion, whether socioeconomics, age, family of origin, or other factors weigh in or not, goals should be operationally defined in terms of what the client states would measure them being, quote, less depressed, less anxious, more healthy, less in pain, more assertive, or a whole abundance of other sort of goals they may come in for. Other areas which may impact the counseling relationship can include things like age or generational issues. For example, if I'm talking to someone who grew up in the Great Depression or in World War I, I've not lived through those things. I might not have the same knowledge or experience of going through the struggles where some of those kids had to work in factories at young age. Some people had to really live on a meager income and scrape. Sometimes the whole family essentially was working. There was just a different mentality. I might have a client who's a geriatric client who loves to tell stories about the war era, what they've survived through. And that may be very different from what I've survived through. My experience as a, quote, survival might be so different from what they're talking about. So it may be important to really hear their narrative. We have some other videos that we'll take a look at on the age and generational issues. And the key that we see without stereotyping is that there are some general principles that are unique to each generation. For example, those people who grew up more in the Great Depression tended, because of growing up in the Great Depression, to really believe work is very important, and you work hard, and you toil out whatever's set before you, and you really never stop working. They really believe and place an emphasis on work. Even we see that with the baby boomers as well, that they continue to emphasize work. You'll see a lot of times, whether it be someone handing carts in a grocery store or whether someone consulting with young business professionals and mentoring them, you'll see that the baby boomers continue work at some level into old age. They feel like if they're not working, they're not productive. Whereas you may see, again, these are generalities, but you may see in the younger groups, the millennials, the Generation Xers, the people that are coming up now and getting their first jobs, a very different worldview. They may not stick with one company for 20 or 30 years, as was once common. They may not believe in working until you drop. They may believe in, let me work smarter, not harder. If I can retire at 35 or 40, so be it. That would be great. They don't think anything sometimes of if the employer's not what they want, to go ahead and just look for another job or change multiple jobs or even multiple majors or careers, move. So you hear some different philosophies in things. There may be more of an approach of entitlement, enjoying life, kind of more of the balanced life rather than just work and saving up and that sort of thing. Again, I know these sound like stereotypes, but they're important to consider. And it's also important to not deny the fact when it becomes apparent that there may be some age difference or some difference in life experiences between you and a client. I wouldn't pretend to know what the experience of someone who had gone through World War I or the Great Depression's like. I might even make a comment to that person if they wanted to talk about that in their therapy, that, wow, this is something that I haven't gone through. I may have heard some stories from my grandfather, but I'm interested in hearing what you've gone through. So it's sometimes important when we have people from different age or generational areas to not deny the impact that might be in counseling. Likewise, there was a time when I was in my 20s where I was close in age to the young people and the teenagers, and I was more cool and could identify with them. And now I think I'm sort of cool to them, but I'm getting to the age where I'm getting a little bit uncool, unrefined, and not knowing what the latest kind of things are that some of the young people go through. So that is something that may need to be brought up. Rather than deny things, again, I think it's very important to bring those things up and remember that the counseling is a therapeutic partnership. You can't go wrong by taking the approach with any client. Tell me your story. Thank you for inviting me in on this therapeutic journey, and let's figure this out together. I might not have the same narrative as you. I might have grown up in a different generation, but let's see if we can figure this out together. So what kind of preparations could you do ahead of time if someone shows that they may be from a different cultural worldview on any of the host of array of different areas we've talked about? What I think, again, minimally is important is making sure that you at least know information, facts about the groups that tend to come to your practice setting. Know what kind of struggles they've gone through. Know some of the history that's made them grieve or have bitterness or concerns or struggles in life. Know what are some of the narratives which have empowered them to be resourceful in the type of people that they are. It's really important to study on that. And if you don't know, be willing to find out information. Be willing to go to the healthcare resources in their community. Be willing to talk with the ministers in their community. Be willing to attend social events in their community. Be willing to ask them what goes on. Be educatable. That's the real key on things. Don't try and impose what your worldview and experience is, but try and learn from theirs. This also taps into that important topic that we made reference to about social justice. We talk about the debate of, is it our place to make sure everybody has equal access to resources and rights? And people have debates about if that's a role for the mental health professional or not. But the key is, if we're going to in any way have those social justice responsibilities and actions and reactions to what the client's going through, we can only do that if we really have an accurate picture of what they're going through. So it's important to tap into the resources, the collateral sources of what they're going through and living through, and make sure we have adequate information. And if we don't, make referrals when we need to. In conclusion, hopefully you get the picture that multicultural counseling is so multifaceted. There's not one area, as we used to think, like ethnicity or where a person's from or how they look or just what we see on the surface. Unless we actually explore and ask a client directly, we'll never know the whole story that makes up that person. That's one reason I love being in the mental health field, because we have each person as a unique new experience that we can individualize our treatment goals to. If you take the approach of help me understand you, what's important about who you are, what do you want to be part of your treatment process, we can't go wrong when we're doing multicultural counseling.